Hello everyone, I am Dr. Ekta Daftari, a Neuro Occupational Therapist, having done my post-graduation in Neuro Rehabilitation from Auckland and certifications in Sensory Integration Therapy from University of South California, US, and in NDT, that is Neuro Developmental Treatment Techniques from NDT Association, US. I have over 20 years of clinical experience and I have opened this channel primarily to help parents and caregivers of special needs children to understand their problems better, and in order to increase their knowledge and their ability to implement certain therapeutic activities which they can do at home. So to sort of enhance and facilitate that process of homebound therapy, the entire idea is to enhance the potential of every child and to facilitate the parents to be able to better care for their children. So I hope I will be able to accomplish this through this channel by uploading content which is valid and knowledge oriented, and also by including professionals of various other disciplines who can also help to answer the queries of parents if there are any such queries. So now the first thing that I would like to address in today's video is a question that I have been repeatedly asked throughout my clinical practice, which is, what is sensory processing disorder, or what is sensory processing problem? Now the term, when a parent hears it for the first time, can be pretty scary because it's like, what is this? We have no idea about it. So when the first time the child is diagnosed with a sensory processing problem, be it autism or ADHD, then parents often have this query about what this is all about. Now let me help to explain that in as simple a language as I possibly can think of. Our brain, our nervous system, absorbs stimuli from the environment, from all around us, loads and loads of stimuli throughout the day, through 5 basic senses, which are the tactile, that is touch, hearing or auditory, visual, our movement, wherever we are moving in space, whenever we are moving anywhere, our brain is getting stimuli as to where our body is in respect to the environment, in respect to the space around us. So that is the vestibular system, smell or olfactory. So these are the 5 systems, the sensory systems that we have. Now, once that stimuli reaches our brain, then it is further disintegrated, so to say, or integrated from the various receptors that it is reaching the brain. It is integrated and analyzed and processed so that we can make some sense out of it and respond accordingly to that stimuli. Now here, let me just put in one little thing. One other thing that influences this is our feedback mechanism, because we have memories associated to similar stimuli which are stored in the brain in that feedback loop. So if we have good memories related to any stimuli which is similar to what we are receiving at that present moment, then that memory kicks in and it guides and influences our response. So if it's a positive feedback, then we would want to try that stimuli, we would want to try that thing, whatever is coming, or whatever we are perceiving. Or if we have negative sort of memories associated with that experience, then we would want to avoid it. We would just run away from that, or just not want to explore it further. So that is another thing that influences our behavior, which is in connection to the stimuli that we receive. But the major thing is that our brain processes that information to make sense out of it. Now, a neurotypical brain, which is a brain without any problems. A neurotypical brain would react differently to the same stimuli than the brain of a child with special needs. Why is that so? Because their brain is wired little differently. Hence, many times the processing of the stimuli from either one system or multiple systems is not happening the way it should. So the child is not able to fully understand the stimuli that he or she is receiving, and hence the behavior, the outcome is different than what we would expect it to be. So parents get very troubled because let me give a simple example. For example, a child might not want to try or to touch a particular texture, which could be a very normal thing, a very normal texture. But your child will start crying and howling whenever you try to make him or her experience the touch, that particular touch. And you would be wondering why they are responding in that particular manner. It is because their tactile system is not, the information that is sent to the brain through their tactile system is not being processed appropriately. And that information could be pretty overwhelming for the child. Hence, they want to avoid it. Hence, they go into a defensive mechanism. They want to avoid that unpleasant reaction that they are feeling when they are exposed to that stimuli. Now, so parents get worried as to why our child is behaving in that particular manner, because they are not able to understand that the child is not trying to be difficult, not being disobedient, but it is just that his or her brain is perceiving that stimuli differently. It is not being able to process it normally, and hence that particular sensation is very uncomfortable for the child. It can be overwhelming for the child, and hence they want to just push it away. They don't want to experience it, which is normal. If we are not liking a particular thing, then we obviously would not want to experience it, right? We want to shun it away, and that is what the child is doing. Similarly, you could have a child who would probably want to touch everything that they come across. They would come and touch your clothes again and again and again. They would want to touch everything in their environment. If you go to a friend's place, then they would go and start touching their clothes and start touching everything in their house, which could be a little embarrassing for you. And you are like, you would scream at the child, you shout at them, but they are not able to stop. They will keep on doing that. Now, why is that happening? Because that is a seeking behavior. Again, the processing is a problem, and here they are hyposensitive. Whereas when they were avoiding or they were showing a defensive behavior, they were hypersensitive to that stimuli. Here they are hyposensitive to it. So their nervous system is taking lots and lots and lots more of that stimuli to be able to make sense of it, to be able to process it, to be able to understand it. And they are liking that, so they are seeking it. And that is the reason they crave for that sensation over and over again. So here again, the child is not trying to be difficult. The child is just reacting to what his or her nervous system is triggering. So this is something that I would want the parents to understand. Because if you do understand this, then your entire behavior or reaction to your child changes. You are able to understand their problems, their difficulties, and view things from their perspective as to what are they undergoing. And hence you can be a little bit more empathetic towards them instead of screaming and shouting or beating them up or trying to forcibly stop them from showing that behavior. Another term that parents find pretty confusing is modulation, sensory modulation. Now, when we as adults experience a particular stimuli, let's say we hear a very, very good news and we are overexcited about it. But if we are in a meeting at that time, then looking at our present scenario as to where we are, if it's a formal setting, then obviously we curb our response. We will not probably show the same response to that particular good news as we would if we were at our home. We would be screaming our lungs out with joy, but we wouldn't show the same response if we are in a formal setting. This is because our brain is able to modulate our behavior, and we are then able to give a response which is appropriate to our present environment. Now, a child with special needs, his or her brain is many a times not able to modulate the response, and that is why they will show us extreme reactions for a particular stimulus. And this is called sensory modulation problem. So the earlier thing that we talked about was all about the sensory processing problem, sensory processing disorder. And a part of that is also the sensory modulation problem or sensory modulation disorder. And through occupational therapy or through sensory integration therapy, therapists who are trained in sensory integration therapy, they talk about certain activities which is totally dependent on what the root problem of that particular child is, which systems are involved, where the processing is not happening, and to what degree is that system involved or the processing is affected. Depending on that, the specialist or professional will chalk out particular treatment program or activities wherein we enable the processing to become more efficient. We enable the child to be able to take in those stimuli, and we enable the nervous system to start responding in the appropriate manner towards that particular stimuli. And all this is done in a very, very playful manner, because with kids you have to ensure that it is very, very interesting, motivating, and enjoyable experience for the child. So it is planned in a very, very playful manner, and gradually through therapy over time we are able to sort of help the nervous system process these information better, and the child is able to show us better responses, more appropriate responses. And throughout this process, as we are able to increase the awareness and cognition of the child towards these stimuli and also towards the environment, the child is able to better modulate the responses depending on whether the child is in a formal setting or a private setting. And gradually we are able to teach the child to behave in a more socially appropriate manner towards a particular stimuli. I hope I have been able to answer your queries. I hope I have been able to impart a little bit of awareness and knowledge towards what sensory processing problems are and what modulation issues are, and how is it that we as occupational therapists help in bringing about a change. So if your child has been diagnosed with a sensory processing problem, it is an occupational therapist who is trained in sensory integration therapy whom you have to consult and contact for to understand what interventions are needed to get the assessment done first and thereby get more professional guidance. I will be uploading more content regarding what particular activities you can do at home depending on the various systems one by one, so that I'm able to help you start off with certain activities which are homebound therapies. Thank you so much. Thank you for patiently listening to it, and I hope it has been helpful.